Uganda Family TV. Enriching lives. Regulated by the Uganda Communications Commission.
Great, and welcome to the Coffee Break Conversation. Once again, my name is Rita Nandura, and today's topic or discussion, we're looking at the right way to brush. Are you getting it right? And joining us in these conversations, Dr. Hilton Nahabwe. But before we get into further discussions, a little bit of statistics in Uganda. Over 70% of school-going children have poor oral hygiene practices, with 71% in Kampala not brushing twice daily. Studies show that only 50.8% residents in formal settlements have poor oral hygiene, and 75% of adults suffer from the tooth decay. And over 53% of adults brush only once daily. So we want to understand what is the best way of how we are supposed to brush. Where have we been doing it wrongly and where have we been doing it rightly? So Dr. Hilton Nahabwe, he is the president of Federation for Uganda Dental Students Association, who is going to teach us. I believe he has the equipment already with us here for the viewers to understand the right way to deal with their teeth and so many other things. So thank you for joining us. Good morning.
Good morning. Nahabwe Hilton is my name. I'm a president for Federation of Uganda Dental Students Association.
Okay. I'm
so happy to be hosted once again in this studio. Last year in May, when I was here, I promised that when I come back, we shall talk about how to brush. That time I never came with a model.
Yes.
I thank God that today we came with it. So Federation of Uganda Dental Students Association began way back in 2020.
Okay.
And it was begun by Uganda Christian University dental students and students from Makerere. At that time we had only two schools, but as I talk, our membership will have KIU, we have Equator University, we have UCU, we have Makerere University. Actually, very soon, by next year, I think we shall be having a FUDSA University. There is another university which is teaching dental surgeons. It's called Jeff International University, is that side of Butabika. I'm involving them. I'm in touch with the dean and the students so that they come on board. So every year we always organize a national quiz, and on 7th and 8th of March we shall be in Isaka at KIU, where students come on board, and we have a panel like students from different universities. We compete. We get somebody, a surgeon who conferred years back, come with very many questions. Then they ask. The winner takes the prize. Then after the quiz, we shall have elections because my term is ending. Term of office is 1 year and it is ending. Then after that, we shall have a football match. Actually, last year, Equator University took the cup, the medal. So this year, UCU may take it. We are warming up for it. Yes.
Great.
So we are having that activity on 7th. Then 8th, we shall have a tour to the national park. You know, people sometimes we studying year to year minus having rest. It's not good. So we have to go to the national park after that activity. Then we come back to books. Yes. So this one is part of what we are doing. But last week we happened to have even a first annual dental camp organized also by FUDSA in conjunction with Buganda Kingdom. It took place in Gomba County, at Kabrasoke Sub County. We happened to register 210 people. We treated them for free. We taught them how to care for their teeth. We did extraction. We did even some feelings, and other cases were referred. So why we did that, we need, and it will continuously be done, because we need the community to understand how best can they can they prevent these dental ailments, dental problems from taking place? It's not only just dental student. After you have completed your surgeon, you go begin your clinic and you start waiting for what? For the patients. We need you to understand how can you prevent that problem, because dental cases are preventable. Those dental caries are preventable once you do right. But majorly, our main concern is, do people know how to blast? They don't know.
Oh yes, and let me looking at now the statistics of this poor brushing and oral health in Uganda.
Yes.
You can give us the picture, how is it standing right now?
It will not deviate from yours, but basically, school-going children are having a lot of challenges, because when parents are asked to pack for their children, most of them they pack snacks, they pack, how do you call these smaller
The sweets?
No, not sweets. Something like
Snacks?
Like, let's call it snacks. So they pack a lot, and when they give them money, what they can afford to buy for their children, what from that money, it is sodas, it is candies, biscuits, all that. Talk about it. And whoever the child is using that when he's studying, at break, at lunchtime. Actually, some people even dodge lunch and they take snacks. But how often do they blast? Most people, when you ask them, they blast at this early in the morning.
Yes.
But it's not right, because when you are sleeping at night, when you are sleeping at night, the bacteria gets an opportunity to multiply, to eat, to consume on the foods you have left on the teeth, and they decompose them. In the morning. That's why, like, in the morning you wake up when you are like, the mouth is not smelling nicely.
Yes.
So if I encourage people, at least always don't forget to blast before you do what? Before you go to sleep. It is very, very important. And how do you blast is also another issue. Some people, you find they blast very well, they blast so much with a lot of force, they do it wrong way. So today I want to teach basically, how do you blast? What is the right way? How do you do it?
Okay.
Because actually, before we go out on how to blast, some people, they always say, doctor, for my, I no longer want to use your corrugate. Those toothpastes are not good. Or the more I use them, the more I get a problem, the more I get a challenge. No, the problem is not with our toothpaste or the toothpaste you buy in the supermarket or anywhere. The problem is how you use it. So some people have even left buying toothpaste. They are now using, some people are using charcoal, others are using herbal medicine.
But they believe it's the best more than this Colgate that we are talking about.
They are best.
That's what they're saying.
Those are just misconception. But the best, the challenge is on how do you blast. Yes, then other people blast, and they blast so much with a lot of energy. When you use a lot of energy, you find you have spoiled the gum. You spoil the gum, and you find even the teeth have dropped the holes. You find somebody, all the teeth a long way from the posteriors up the anterior, they're having like a rail, let's say. Yeah, there is a hole there. Why? Because you've been using a lot of energy. A lot of energy. That method is not good. So we are here today. I want to teach you best way how we can do it, so as you can even teach your community there, because there are some people who are not watching, but who may need to do who may need to change how they do it. So
we can start with the first step.
Yes. So what we normally encourage, we have very many methods of blasting. We have horizontal method, we have vertical, we have circular. But we always advocate for circular motion. Like when you start, this is your mouth. When you start with upper teeth. Reason, when you start with lower, then you blast upper. Now you will like the food is, when you end with upper side, now it will go back here. So you are dating where you are blast. So you first begin with upper and begin with posteriors. Put there the tooth blast. You do circular way, in gentle way. Actually, we advise, after you have eaten the food, don't take long when the food have not yet stuck on the teeth so much. Gently, circular, gently, Spatula gently, spatula gently, like this, spatula gently, do like this. But now when you reach here, spatula may not work here. Here you can use like this. Then continue. Here spatula, after you blasting them inside, same way. From there, you also blast this side. From there, you do like this. Then here, between on these holes, fissures here, use a lot of energy. Why? Here, because these pits, these holes here, the food stick there.
Okay.
So if you blast also here gently and you leave some little foods, problems. That's where holes come in. Actually, most holes are always on these pits here. So here you have to use a lot of energy so I remove everything. When you have finished that, go on the lower teeth. Also spatula gently like this. From there, blast inside. Also, after you have finished first, blast inside. Here like this inside. Don't forget to blast the tank. So when you have done that, you are supposed to have your water there, and your toothpaste there, and your toothbrush there. First blast minus, we could call it teeth cleaning. First clean your teeth. First use a toothbrush minus putting there toothpaste. First clean your mouth with water. After you have cleaned, all your teeth are now clean. Get your toothbrush, clean it well with water. Now put there a toothpaste. You do how we've been doing it very well, gently inside and outside, up and down. Spit the foam and go away. That little grams of toothpaste that have remained on teeth is very, very important for strengthening your teeth. So when we are studying, just in primary, they used to tell us fluoride is important for strengthening the teeth. But I could ask myself how. So fluoride, even if your teeth have just developed some incipient caries, some little caries have just begun, and you start blasting this the right way I'm telling you today, the hole will disappear. How? Fluoride helps in a remineralization. Fluoride, it combines with, there is a way to react with the cavity, with the minerals in the tooth, and it forms back the lost substance of the tooth. So with time, when you continuously do that like that, the dental caries will be stored. So people, what they normally do, they have been doing antagonistically. How? Somebody blasts very well, does it very well, but after brings water and removes everything. But that one is called the toothpaste. So if it is a toothpaste, why are you now removing it? You are using it as a tooth soap. That is wrong. So if you change the way you've been doing it, basically the problems of dental will be minimized. Yes. I want to remind to all the viewers that you are supposed, even if you don't have any dental problem, your mouth is okay, you still have all your satetu teeth, you are supposed to remember the following tips. Put them just on your, we call them fingertips. Number one, visit the dentist at least twice a year.
Twice a year?
Yes, that is every 6 months. If you've done it in December when the children have come from school, go with all your children. If you have a family, take all your family. They check one by one. If a good doctor find their holes, you will cement them, or you plan with your dentist. You make an appointment, you'll come back, and they do what? They fill them when you have gotten the money. If they find the teeth are for cleaning, they can clean them there and then. Don't wait for the problem to escalate. Some people wait until when they have swellings. No, don't wait for that. So basically, that is point number one. Visit the dentist twice a year. Then avoid eating too much sweets between meals. I want to explain that. What if you want to eat snacks? Like for me, as I talk, I don't like water. Water is life, but I don't like it. Me personally.
Okay.
I like soda. So if you want to take breakfast, you like soda, you like your candies, bring everything on table. Take everything. Then after you brush. But this business of like, no, for me I like these things. Every time you are eating, you are spoiling your teeth.
Okay.
The teeth, dental problems are very expensive. To buy an implant in Uganda. I think in Uganda it is still cheap, but in other countries it is like 10 million. But in Uganda we can buy it at 7 million. So to avoid all of that, befriend the dentist. Be a friend to the surgeons. Look for you have your family doctor there. Look for the good dentist, your family dentist. Bring the people, check them. But some people fear, they know when they come, when you find their problem, will scare them. No. If you don't want to get scared, the pain will scare you, you will come. And root canal is expensive.
Yes.
A root canal, when you have done root canal and you don't want to remove the tooth, when you have finished it is 4 appointments. After I've done 4 appointments, you need to put a crown. The crown itself goes for at least 1.5 million here in Uganda. On Uganda market, a good crown. So you find you have put like 2 million in one tooth to save it. But if we say, come for checkup, if you bring your family in Mengo Dental Clinic, a consultation is only 25,000. If you bring a family of 10 people, 250, they check and they advise you, you go away. You not pay another money. But if you wait, if you don't want to come, you'll come like 3 of them, they're having pain, you'll end up cost you like more than 10 million. So prevention is better than cure. So we always advocate, we always encourage you to do what? To go for checkups. So avoid eating too much sweets between meals because they will bring problems. Thirdly, eat fibrous foods alongside other foods. What do I mean? Fibrous foods includes like sugar cane, apples, pineapples. Those fibrous foods, they help in cleaning the teeth. When you are eaten and you don't have time to brush, end with the sugar cane. The sugar cane will clean, yes. Then eat foods containing vitamin C. Vitamin C will help in good development of your gingiva. Your gingiva will be healthy, your gum will be healthy. Last but not the least, you should at least brush in a right way and brush using a good toothpaste. A good toothpaste, what do I mean? Toothpaste containing fluoride. Don't just go and buy whatever you found on market. First read on how much fluoride am I buying, am I taking. I used to buy this and it was containing this and my teeth were okay. So don't buy something with little fluoride. Actually some products are on the market and they don't even have fluoride. People just make different models. For us as dental surgeons, we don't advocate for herbals. We don't advocate for herbals, we advocate for these modern toothpaste.
What's the problem with the herbals?
They don't, some herbals, they don't, people don't calculate, the concentrations are not calculatable. Somebody will tell you, when you use this one, it will chew your teeth. That's a lie. They don't chew, but just they have some component which can relieve pain, but they will not have fluoride. So that's the problem with herbals. But modern toothpaste are okay in that you read there, you know the fluoride you are using. So brush in right way and use a right toothpaste. And the toothbrush, some people use this toothbrush for very many months or until when it has gotten lost. No. Every 3 months you are supposed to change a toothbrush.
Every 3 months.
Every 3 months. Change. Straight away, buy another one. When these bristles are still, when the bristles are still okay, but you find these bristles are now looking Kalele, others are looking in Mulago, but somebody is still using this toothbrush, doesn't want to lose his money. So you are supposed to use it when it is still strong, 3 months. When they are starting to worn away, don't wait it for it to be so much. Okay. So use it 3 months, buy another one. You can buy 4 for this one will take me for the year. So it is also very, very important.
Okay.
Yes.
Yes, Doctor, allow us to get into a quick commercial break. We'll come back with more of this conversation when it comes to our health of the matters, and matters a lot.
This is Church of Uganda Family TV. Enriching lives. Regulated by the Uganda Communications Commission. This is Church of Uganda Family TV. Enriching lives. Regulated by the Uganda Communications Commission.
Now, for those who have just joined us, we are looking at how we can be able to brush our teeth in any way so that we can be able to prevent this kind of issues we experience, most especially when it comes to our growth and maybe the young people, the adults. So, yes, Doctor, in the first segment gave us some of the ways how we can be able to brush our teeth. So, Doctor, right about now, we want to find out, because if you look at this, it's all white, yes? Some of the people's teeth are brown. Yes, the color has changed. Then also look at the tongue. At what color is the tongue supposed to be? And how do you tell that really my tongue is getting berserk, or some other things we may see on it? Then also you mentioned about I know how you called upon this. We have some incidents we experience whereby food enters within this pass in here in the middle, and we believe this this toothbrush cannot be able to deal with all these things which enters in between here. So help us to understand how can we be able to deal with this, the two of them. Thank you.
So when you finished brushing, there is what I had forgotten to talk about. There's what you call flossing. Flossing. You are supposed to have a floss at home.
What's that floss?
Floss is like a thread, something like a thread. You have to buy it in a supermarket. You can go to the supermarket and you're like, I want a floss, dental floss.
Okay.
A dental floss. So when you have finished, there are some foods that cannot be removed from between the teeth, interdental between the teeth. Sure. So what you do, after you blast, pass it through the what? The teeth, all the teeth. So some people will say, it is tiresome.
Oh yes.
But if it becomes tiresome and the hole comes and pains you, it will cost you some good money, even time.
So it causes the hole to come into the...
Yes, because between the teeth, you can blast very well, you see what teeth are okay. When between the teeth, when the teeth are okay, but between them, there is a problem.
Okay.
So dental floss is always advisable. It is a must. You must be having it at home. You remove between all the teeth. After you have blast, it is not enough. You have to floss. Then you rinse with water. You make sure that all the foods have been removed. Then you've talked about the color of the teeth. What changes the color of the teeth? Actually, our teeth are supposed to be like this.
White. Okay.
But as you grow up, because of the foods you've been consuming, the water you've been taking.
You mean, doctor, the water also causes the teeth to change? What does water has effect? Does it have any effect on...
Water, majorly water. If you, some people actually like from Kabale, from Kasese, those mountainous areas, there is a lot of fluoride.
Okay.
Like solo.
Okay.
Find somebody has teeth from just 10 years, you realize the teeth are yellow. We call it fluorosis.
Okay.
Fluorosis.
Okay.
So that one, they say too much of anything is always bad.
Yes.
So fluoride, we need it, but if it becomes so much in the water you are taking every day, the water your mother was taking every day, you will get that fluorosis, and that one is not easy to prevent. You cannot prevent where you are born from.
Okay.
But, yes, but we can treat it if you come and you are not comfortable with your aesthetics, with your smile. We can treat it from dental clinic. There is a way we can treat and you become fine, and your teeth also becomes white again. So, if you find, you talk even about the tongue. The tongue is supposed to be pink in color. Pink pigmented, majorly tongue and the gum.
Yes.
But if you find now it is so reddish in color, or it is having
black
patches. If it has black, actually not black, chocolate. If it is chocolate, sometimes actually some people even have chocolate gum, gingiva. This gum, it is chocolate in color. It's okay. It may be a race. Some races have chocolate gum and but the tongue, which is chocolate, I've not yet come across it. So if you find the tongue is having some patches, maybe it is having it pains you, you need to go for what? For the dental checkup. Actually, in the mouth, we have more than 1,000 dental conditions there in the mouth.
Okay.
So, if you feel anything that is abnormal, go to a dentist. Don't wait. Don't wait for it to worsen. Then you start thinking about going to the dentist with it worsened. If something small, when you have a car, when you feel something, when you're driving and you feel it making some unnecessary noise, you go to a mechanic. So here, why do you wait for this condition to worsen when the dentists are there? That's it. They are waiting for you. They want to test to check your teeth and they advise you. Yes. So as far as the color is concerned, maybe if you see anything which is abnormal, go to the dentist. They will help you. Yes.
Someone may be asking himself a question. My tongue is having some black spots. You have seen some with tongue with black spots on there. Is that okay?
The black spots on the tongue?
On the tongue, yes.
It depends. If they are not paining you, it may be genetical.
Okay.
You may find maybe even your daddy's tongue is like that, it may be genetical. But I cannot conclude if I've not comprehensively checked you, if you have not come to the clinic. Yes, basically I cannot check it from the studio. If it is an ethical, it is a professional, you have to come to the clinic, we check you, we advise accordingly. But since it is not paining you, it may be genetical.
Okay.
So all the viewers, I must encourage somebody, don't wait for the dental problems to worsen. Then you start thinking about looking for the surgeons, Maybe if you have a lot of money, you want them to
You come and they'll spend.
Yeah, you spend.
Yes, to interfere a little bit, naturally, how many teeth are we supposed to have?
An adult person is
An adult, yes.
An adult person is supposed to have 32 teeth. So if you start losing by the age of, let's say, 14, 15, and If you lose one, you cannot finish 2 years minus losing another one.
So what is the disadvantage does it cause?
If you lose the teeth.
You mentioned about the age of 14.
Yes, if you lose early. Number one, if you lose one tooth, where we have removed it, you've removed from a dental clinic, there is a hole, there is a wound there.
Yes.
So in that period, when the wound is still healing, you can't blast these neighboring teeth very well.
Oh yes.
So the food will accumulate on these neighboring teeth. By the time you have healed very well and start blasting, you cannot remove them. They have got what we call plaque. That plaque itself will come now result into dental caries. Now another one will result in this one. You cannot spend 3 years minus losing another one, provided you have lost one. So we always advocate for somebody not to lose any tooth. Unless this one is for young children, which are there's what we call the deciduous dentition. This one for children, at least there it's okay. We are supposed to remove them, so as of course for them they are just keeping the space for the permanent dentition. So those ones we always maintain them, but once they start shedding,